It's tough to see your kids sick and struggling with recurring health problems. Parents, if your child is suffering with sleep apnea, snoring, ear infections, or throat infections, might be time to see a specialist. Our ear, nose, and throat expert, Dr. Al Fleming, is here to help us know when and where to go. Welcome, Dr. Fleming.
Crystal, thank you for having me. It's my pleasure to be here.
Thank you for being with us. Now, a lot of parents watching they have kids right now struggling with recurring throat infections, ear problems, some of them for years. How can seeing a doctor like yourself, an ENT, help?
It can be very helpful, and I know what it's like to have a child who suffers with medical issues. It can be very challenging.
Sure.
Seeing an ENT doctor can be very helpful because there's lots of ways that we can really help with the health and well-being of children, and sometimes very easily, and we can even do it without the need for surgical intervention. We work very closely with our pediatricians in the community and our pediatric allergists also to help figure out the best way to take care of children.
Now, you trained at Nationwide Children's. Let's talk about just how specialized the training gets for an ENT.
Sure. So I actually did my pediatric portion of my ENT training at Nationwide Children's Hospital. I did my ENT training at The Ohio State University. So all ENT doctors are trained to take care of children. And in our practice at Ohio ENT and Allergy Physicians, we take care of about 60% of our patients are pediatric.
And you said as young as a day old, some of them.
Sometimes, yes.
Wow.
Yes.
Now, other areas that Ohio ENT and allergy physicians specialize in are pediatric sinus and sleep apneas. I myself have a son who snores, so let's talk about that problem. A lot of other parents wondering.
Sure. So the most common things that we see at Ohio ENT and Allergy is actually children with ear infections, coming in for consultation for ear tubes. The second most common thing is recurrent tonsil infections, looking for potential tonsillectomy. Now, that being said, most of our treatment is medical, and a lot of times we can get by without requiring surgery, and that's where we really have the help of our allergists and our pediatricians in the community. As far as specifically with sinuses and children, it's nice because most of the time we just recommend medical management, figuring out what's at the cause, what's the root, maybe doing an allergy workup and treatment, doing some topical nasal sprays, and then only in the rare cases where a child would need surgery, sometimes we recommend something like an adenoid surgery or turbinate reduction. We almost never recommend sinus surgery for children, which is nice.
Very good. Now, parents may be wondering, how do we know when to bring my son's snoring just normal? It's just the way it is. Or is it something we need to come see you guys for?
Right. So as far as when to bring in a child, so we do rely on the expertise of our community pediatricians to help guide parents as far as when to bring their children in to see us.
Okay.
But as far as, for instance, for evaluating for ear infections, we use national guidelines that are developed by pediatricians, ear, nose, and throat specialists, anesthesiologists across the country help us determine guidelines. So for ear infections, for instance, it's based on how long a child has persistent fluid in their ears, whether they respond to antibiotics or not. It's not solely based on the number of ear infections, but how it's affecting their quality of life. Are they miserable? Are they having drainage from their ears, hearing loss, balance, those kinds of things? And if they have persistent fluid for over 3 months and they're having other issues like that, that's a time when we'd see them for the ear issues.
And we're running out of time, but real quickly, tell us in a nutshell why working with an allergist is so important now for kids.
It's been very nice to work with our allergists and pediatric allergists because it's so nice to really figure out the best way to take care of children without without interventions, without surgery if we can, and that's where allergists can be really helpful at really figuring the best relationship I can think of to have.
It's a crucial relationship.
Yeah, it really is.
Dr. Fleming, thank you so much. And parents, for more information, the information to contact Ohio ENT and Allergy Physicians is on our screen. Thank you.
Thank you.